So I try every 12th of December, which is the day set aside to commemorate the Universal Health Coverage Day, to probably have meetings, have conversations, just to engage people in the discussion. And today is one of those days, and I'm very happy with the guests that we have because it's quite a diverse panel. We have somebody in the journalism sector, and we have another person in the medical sector. So it's quite a balance. So if you're just joining us, you're welcome. We're going to be talking about universal health coverage in Cameroon. Definitely, some of us may be aware what universal coverage is, others may not be. But whatever the case is, you're very much welcome to this discussion because we're going to try to make it as practicable as possible. We're going to avoid using all the medical jargons and try to make it a very practical session. And hopefully we stick to 1 hour so we don't exceed, we don't talk so much and forget our time. So without wasting so much time, I'm going to be starting with Dr. Clarence. It's really just a conversation, but very practical session about universal health coverage, about Cameroon, and just putting all of us on the same level first. So Dr. Clarence, I would like to ask, before we start going into all the politics of UHC phase one and all that, can you just really brief us what exactly is universal health coverage? Because lots of people talk about it. Some people do not know about it. Some people probably just heard about it in passing. So can you just give us an overview of what universal health coverage is, of why it's important and why we are gathered here, and especially in Cameroon, why is it an important agenda? So if you can just run us through, I'll really appreciate.
All right, thanks very much, Ada, and good evening to everybody. Yeah, just as a brief introduction, I'm Clarence Banga, physician by training, and I also have a training in public health. I've had the privilege to practice in rural communities of Cameroon for almost half a decade before, joining the public health space, where I've been also really actively involved in, trying in one way or another to better the health of our Cameroonian population for almost another half a decade as well. So it's a pleasure to be here. Yeah, so Ada, to your question, I think it's really important for us to set the scene before we start delving deeper into, the intricacies of universal health coverage. It's important to have our audience know what universal health coverage is. So I try to make it as simple as possible. So when we say universal health coverage, we mean it's a definition I can break down into three things. So the first thing is all people. And when I say all people, that means in a Cameroonian context, it means whether you're Anglophone or Francophone, whether you're male or female, whether you're from the Northwest or from the center, whether you are Hausa or from Com, whatever it is, all people. So that's the first component, which means it's something which doesn't have any cultural or gender or socioeconomic barriers. So we have all people having access to the full range of quality health services. In other words, everybody, irrespective of their sexual orientation or their sex or their cultural norms, have access to quality health services. And these health services fall across four broad categories. It could be preventative health services, for example, vaccination, right? You take it not because you have a disease, but you want to prevent the disease. It could be treatment for diseases that we already have, like malaria, for example. It could be rehabilitation. In other words, you've had a condition that has led to a disability and you want to work your way out of the disability. It could be something like drug abuse. It could be something like maybe a fracture that gets you paralyzed after a road traffic accident. And the last component of that care is really palliative care, which is kind of the care that they give you when you have diseases that have no cure and they are at their end stage. That's the second component. So all people have access to all of these services when they need it, where they need it, without having to incur financial hardship. In other words, without having to spend so much that they find themselves in a difficult place financially to meet up with other needs of life. So basically, those are the three key components of universal health coverage. I'll pass it back over to you, and be open to provide some additional details if needed.
Okay, thank you so much for really using the very basic terms. For those of us that are present, I don't know our knowledge of universal health coverage, but that is why we are here. And now I'm going to be going over to Gladys. I know you're a health reporter. We go way back, and I know you've been doing so much amazing work. And I know you were even part of the public health conference that holds routinely in Africa. You were there last year. So, as the health reporter and as somebody active in journalism, especially on the national radio, national television station, what is universal health coverage? I don't know. Maybe you can tell us how you came to hear about universal health coverage. What do you think the community thinks about universal health coverage based on your time in the field? Because I know you have so much experience in the field. Can you just give us like an overview of what you think, how you heard about UHC, and what do the people in the streets, in quotes, think UHC is? We're still on basic definitions.
Okay, let me turn on my video. Thank you, Ada. Thank you for this opportunity to share knowledge and learn and to charter a way forward for our country. So for presentation, like it's earlier said, I am Gladys Asungwana, a health reporter, basically trained as a journalist from the University of Boya and now practicing with the Cameroon Radio Television. So hearing about universal health coverage just came from me being in the field. I want to talk about Clarence too, who is working at the Clinton Health Access Initiative. Just from their name, you know that they are there to provide access to healthcare for all. So a few contacts with them in the field also made me know about UHC. And then when the government also started speaking about rolling out the first phase, we did a lot of coverage, trying to encourage people to register for the program or the health voucher. And then came the public health conference in Africa, where there was a whole track on universal health coverage. And just at the time when Cameroon was trying to roll out its plan. So that really gave me an interest to understand UHC and how it can help to fight the health inequity. So for the people, right now, talking about the first phase, it has just been trying to convince them. And the people are really even concerned because if you want to talk about UHC, it's not just about the the bourgeoisies or those who can afford medical care. This plan really has to do with people in the grassroots, those people in places where they don't have basic healthcare services. But if you go to some of these places, you really understand that they are blank. They don't know anything. They don't know. In fact, some of them are not aware. And some in the cities like Yaoundé feel like it's a government plan. Look at, okay, they're starting in 2023, 2024, and 2025, we have an election. So some of them see it as a political agenda and not knowing that is a necessity and something that I want to say is genuine to the government because it has been in the background since 2015, or you want to even say more than that. So yes, while some are open and understand what it entails, others don't know, probably because they have not had access to information. And when I say access to information, I'm not talking about those in the grassroots. Because there's been a lot of noise in the cities and easy to access localities. My village, I'm not sure people even know because we don't have a health center or a clinic and even a road to go to those places. So yeah, briefly, that's what I can say to that question.
Okay, so I wanted to ask, is it called UHC in the community? What do people call it? Because sometimes we're tempted, I don't know, what do people in the streets call it? Do they call it UHC? Do they call it universal health coverage? Do they call it health for all? What exactly do people in the communities call this agenda? How do they see it?
Well, in the Cameroonian context and given the language, the French, is it CSU, the plan couverture? Yes, they mostly call it CSU or health voucher, la carte, check santé, check santé with, yes, the health voucher. So you hear check santé most often. So
Okay, thank you. So, Dr. Clarence, I'm coming back to you. So, having had this background knowledge on the UHC and what it's called and all that, is it really possible that Cameroonians, for example, are able to afford these basic healthcare services without so much of financial strain? That's the very first thing I want to ask. And what is the package? What is in UHC? What is this UHC package all about? Because Cameroon rolled out UHC phase one in April 2023, I think. That was what the report said. So, what is inside this UHC that people should know about? What is the package and where has it been rolled out? We're hearing phase one. Maybe some people don't know why we are saying phase one. So, what is phase one UHC? What was in the package or what is in the package? And where was this phase one rolled out? Maybe you can give us knowledge, both theoretical and practical on the field as well.
All right. Thanks for those questions. Yeah, so I think I'll follow up from what Gladys said. UHC, the discussions around universal health coverage, they run way back to about 2017 or so. So what we see now is really a culmination of a lot of background work, be it politically, financially, and also operationally. And I think Gladys mentioned something which is quite interesting, where they say a lot of people think that USC is a political agenda because the elections around the corner and all that. But even if it's a political agenda, I think for once it's a good agenda, right? So as of a couple of years back, about 72% of Cameroonians had to pay for healthcare out of their pockets. In other words, out of every 100 Cameroonians, 72 of them have to take out money from their income and pay for healthcare services. What does that mean? That means what they have available to keep their families running is reduced because they have to access healthcare. And if you put that into perspective, you realize that it affects mostly the poor and the disadvantaged. Because if someone is earning 20,000 francs per month, hypothetically, and they have to remove 5,000 francs to access malaria treatment, some other person who is earning 100,000 francs and they have to remove maybe even 10,000 francs to access malaria treatment, you see that the poor person gets to suffer from the effect of that expenditure a little bit more than the richer person. So the idea behind UHC is just to really make sure that irrespective of our social status or class, we have access to those basic healthcare services we need without putting us in a situation where we have to choose between healthcare and other important things, right? So it's basically at a point where people have to choose, do I go to the hospital or do I go and, cut some leaves behind the house so that I can save money and do some other things with it. So that's really the place from which the whole idea of UH is coming, is really just to level the playing field, be it in terms of level the playing field between the rich and the poor, if I could put it that way. So it's one of those good political agendas. And in terms of what UHC, the package comprises, so the idea here is it's universal health coverage is not something we achieve at a go, right? It's a process. It takes a while to understand exactly how we can set it up in the Cameroonian context, how we can, finance it to make sure that it's not a 1-year thing, but it's something that, that remains available or that remains financed throughout, a lifetime or a generation, if I could put it that way. And you cannot just jump into those kind of investments without really understanding what it is you have to do. Hence the reason to go from to implement it in the pilot using a phased approach. In other words, to do it one step after the other, right? So in step one, basically, you would see that what the government has done is really just pull together things which they were already providing for free at a subsidized cost into one package. right? So, for example, there are a lot of things that are covered by USC Phase 1, but they center around 5 key areas. Number one is um, uh, treatment for malaria for children below 5. And I think ever since, is it 2013 or so, if I'm not making a mistake with the date, treatment, consultation, treatment for malaria, be it simple or severe, for children below 5 is supposed to be free. There is a policy that says that it should be free, right? So a lot of us don't know about it. A lot of people are not aware. A lot of people go to hospitals and they find themselves paying for those services for reasons that we can talk about later. But that is supposed to be free. So it's one of those things that have been put into the universal health coverage package for Phase 1. Dialysis, for example, it's a lot of money. Those who have to do about 2 sessions per week for a whole year, you find yourself spending lots, hundreds of thousands, and even close to millions. This was already subsidized by the government, but now it has been further subsidized again. So that instead of paying maybe 400 and something thousand, you're paying 15. HIV care and treatment for a while now, every cost associated with HIV care and treatment, be it consultation, be it testing, be it drugs, follow-up, has been free. And it's still one of the things that I've put in the package. So basically what is happening is you're taking those things which the government has already been subsidizing, those things which are already practically free. Vaccination is another example. A lot of the vaccines are given to our children are free of charge. So they've pulled all of that into one package. And the idea here now is to, okay, we are going to select a few areas across the country where we try this out. And by trying it out, what do they mean? What do we mean? It's, okay, I'll take, for example, health facility, hospital X in maybe the Northwest, where people will go to the hospital, have these services for free. But even though they're having it for free, someone is incurring costs, right? The health facility, because the hospital where you go and have your treatment, they have to give you drugs, they have to test you, they have to treat you, right? And that costs money. So the health, you are not paying as a patient, but the facility is paying. And the idea now is for the government to say, okay, you give them these services for free, and then we'll figure out a way to reimburse you for the cost you have incurred, right? So it's really around understanding the mechanisms behind how this will happen is the reason why they decided, okay, you know what, let's do this in phases so that we really get to understand what works, what does not work. And from there, we can better, adjust our plan and our strategy on how to move forward. So for UHC Phase 1, it's literally around that. And like I said before, it's mostly 5 key services. It's free consultation for children below 5 years, it's free treatment for malaria in children below 5 years, it's hemodialysis for patients suffering from renal failure at a really, really reduced cost. There's free treatment for persons living with HIV, be from consultation down to testing, down to treatment, down to follow-up. It's antenatal follow-up for pregnant women plus delivery at a reduced cost of about 6,000 francs. So it's literally things that the government has been doing. They've just put it together in a package now, and they're trying to see how best, facilities can, how best hospitals can get the services given to the population, and how the government can go about reimbursing them for some of the costs that they incur from this. So it's really the idea behind Phase 1. And once Phase 1 is done, we'll have enough information to say, okay, this works, this does not work, this has to be changed, this has to be removed, this has to be replaced. So now go on to investing more in it, right? So look at it like you're trying a restaurant for your first time. You don't just go and buy, enough food to stock up your freezer. You want to get a plate first, see if it makes sense, and then you're like, oh, okay, this person cooks well. I'll come back and get some more, and then I'll put it in my freezer.
Okay, thank you so much, Doc. That was really detailed. Gladys, I'm going to be coming back to you, but Dr. Clarence, just hold on because there's something about reimbursement, and I'm definitely going to be throwing the question back. But let's move on to Gladys. So the theme of universal health coverage this year is health is on the government. So they're spotlighting the government for this particular year UHC Day. So I want to find out, I'm asking a question, Gladys, you are in the journalism sector. So what are some of these campaigns that the government has been doing to create awareness on UHC? Because it's still shocking because there are still some health professionals that I get to commute with, and they still have no idea about universal health coverage. So maybe you can shed some light on what the government has been doing in terms of advertisement, because it's very important. In as much as there's a lot of theories about it's an agenda, it's a political agenda, and all that, it's also a good one. But if there is no proper advertisement, if people don't know about it, then how do people get to participate? How do people get to know what UH is all about? So maybe you can shed some light based on your wide experiences. What are some of the things that Cameroon government has been doing to create awareness on UHC, and what has been the reaction of the public to all of these advertisements?
Okay, that if we've been able to have like over a million, or there's over a million people register in the first phase, it means the government has been doing a lot. They have been communicating, they have been holding conferences, and even in parliament, during the parliamentary session, we saw the minister defend his budget that included also the universal health coverage. And on days like this, I was coming back from work today, and I saw a caravan that had posters of UHC and a megaphone sending out messages. So the government has, I think they have understood that they need to go closer and bring in community actors. So away from the conferences they have been holding to talk about UHC and send out the message, of visiting hospitals to encourage people, they are also engaging in what kind of communication will I term it? But not the usual way of advertising where you do a spot, because for that they have done it. You see it on the screens. If you watch TV, local TV in Cameroon, the thing with people in our country is that some people, they don't watch the news, because we've said a lot. Myself, I've done reports on, like Dr. Clarence was talking about the dialysis that has been subsidized, HIV, malaria. I've done reports talking about the package since last year that they started. So if someone has been watching the news, it will not be like a surprise to them. And then I visited BMRC Hospital sometime at the start of this year. At the maternity section, there is a nurse that welcomes pregnant women or women with children and sensitizes and sensitize them on the availability of this health package. And then just beside them, they have documents that can help register or just let the people know about this plan and how they can take advantage of it. So the government has really been aggressive. I want to say aggressive because you cannot go, even posters, anywhere you find yourself, you see it, the picture of an umbrella and then a different representation of Cameroon on it, telling you that we are all covered under one health plan. And so, yes, that is what they have been focused on. And I know recently with one conference that was held that brought together community health workers, they sought to they sought on how to bring in these actors to promote more enrollment and accessibility. So we only hope. You said you're going to ask a follow-up question, and I'm also interested in that question to ask Dr. Clarence about the reimbursements, because talking to a doctor, a general practitioner, he mentioned that all of these things were already free before, or they were subsidized. They, like Dr. Kaya just said, they have now brought it under one plan or brought it together. HIV was already free. HIV care was already free. Hemodialysis subsidized and has been reduced further. Malaria, I did not know that before there was a policy. I thought it was just with the USC plan that we now have free treatment. But to my shock, even up to today, I'm talking to you from the experience of a doctor in the field, malaria or some of this HIV kept aside, because yes, we have access to the drugs, but malaria, hemodialysis, and others are not free because funding is not coming in and there's no way they can sustain giving out free treatment. So what do we do in such a situation now? How do we expect this plan to be successful? I don't know. If funding is not coming in, the budget that was the health budget that was defended in the parliamentary session that just ended for the fiscal year next year, just 4.25% of it was allocated to healthcare. You can imagine, out of 7,000 billion CFA francs that they have said, well, just 4.25%. It's really small if we are saying that we want all Cameroonians to be healthy. I'm sick. I'm calculating how much I can keep aside to go to the hospital to consult. Dental care is very expensive. So all of those things, I don't know.
Yeah, thank you. I'm going to be coming back to you, Gladys, but let's move to Dr. Clarence because this is a very pertinent issue. And like you said, the question is, you talked about the budget that was allocated. According to the Abuja Declaration, all countries within the global south were encouraged to allocate 50%, 15%, 15 of their state budget to healthcare. But you find us still grumbling, we're still struggling between 3 and 5 for the past 2, 3 years. And that's really it raises a lot of questions, especially because we're talking about such an important agenda, which is UH 2030. And we are already at the end of 2024, which means we're counting down probably 5 years to go to achieve such an agenda. And we're still struggling with even allocating funds for such an important agenda. And I remember when I was taking the course on UHC, I read that for UHC to even be put in place, the healthcare system needs to be very well structured. Now, I want you to hold this question. I'll ask the question, you hold on to it while I switch to Dr. Clarence. The question I want you to hold on is this. Okay, so we've heard about meetings, we've heard about adverts, we've heard about radical advertisements, but I've not seen any comprehensive UHC report so far. I don't think I've come across any of such document from the government of Cameroon that has detailed probably since phase one was launched. Because if I was following the news and some reports online, I heard that they were supposed to launch phase two of UHC between July, like the last quarter of 2024. And I used to always ask the debate, you're probably trying to launch phase two of something as important as UHC, whereas there is no comprehensive gender stratified report on phase one. So I want you to hold that question. Probably there is, probably there isn't, and probably there's a reason, but just hold on to it. Let's go back to Dr. Clarence. Now, Dr. Clarence, there's a lot of issue about reimbursements, and this is particularly interesting to me as well because my thesis focused on health insurance particularly, and there was a problem that kept coming up, which was reimbursement. And I was shocked because there was an alarming situation of reimbursement problems, but very few people are talking about it officially. When I mean officially, it means like documented complaints about reimbursement. It's probably just word of mouth, Cartier talks in codes, quarter talks, and all that. So these reimbursements, like how does it really work, especially with UHC? Because if we're talking about that, there are so many theories. When things like this come up, there are so many theories. There are so many things that people talk about. So how exactly does this reimbursement work? That's the first question. And then we're talking about UHC. And one of the three important pillars of UHC is finance, like where the money is coming from. Because for UHC to continue, we need to know where the money is coming from. If not, there are so many big question marks. So this reimbursement process, how does it work? Or what is reimbursement? Just really break it down for us in very basic terms, because probably some people might not understand what reimbursement means. So what is this reimbursement when it comes to universal health coverage scheme that's already been rolled out in Cameroon, and how does it work? So I know that there's an app. There was a UHC app. So probably you can just run us through. There's a UHC app, stuff like that. What does it cover? Do I pay at the counter, or do I just put the information in the app? And then how can you just give us a virtual picture of, let's just have a picture, an image of how that works?
Yeah, thank you very much. I think that question is one we can debate on for the next 2-3 hours even. A lot can stem out of that. So I'll start from the last one about the app. So there's something we need to understand. The app is not for the idea behind UHC is not for you as the individual benefiting from healthcare to be reimbursed. It's the facility, the hospital that's providing you that service that's going to be reimbursed. So with the app, what happens is you register. So look at it like an insurance scheme, but now provided by the government, for example, and put it that way. So you register to this insurance scheme through the app. And once you complete your registration, you have now what Gladys was talking about. It's like a health voucher or a registration card. That now means, oh, you're registered, so you have access to those services for free or at a reduced price because you are registered, right? So imagine you pay for your insurance, and because you paid for insurance, you now have access to the services that are covered by your insurance. But in this case, now it's free, right? So the app is really just for the end user. And the idea is not for the end user to worry about the reimbursement. So it's not for you to worry about reimbursements. But now this is the tricky part. The tricky part is when you go to a hospital and you are having, say, a dialysis, right? There is a doctor that consults you. It's a nephrologist that will consult you. He has to get paid because it's a professional service he's rendering, right? There are nurses that will attend to you to set up the different IV lines and all the need for the hemodialysis. Those people have to get paid because they are using their time on you, right? It's professional services that are rendering to you. The hemodialysis machine that will have to be used on you, it has to be maintained. There's electricity that's being consumed. So the hospital is incurring costs. You are having it for free. You are having it at a reduced price, but the hospital is incurring costs, right? So there's this back-end arrangement between the government and those hospitals that says, okay, for each hemodialysis patient, roughly what do you need in terms of roughly what is needed in terms of finances? To say, okay, yeah, doctor's consultation, maybe I'm just giving a really rough example. Doctor's consultation, 10,000, nurses time this, dialysis machine this, and the rest. And they come up with a figure, and the government says, you know what, okay, you will charge them, say 15,000, I will pay for the rest. Which means at the end of maybe a month or the quarter, depending on the arrangements, you know, the hospital is supposed to invoice, send that report and invoice to, you know, to the government through maybe the Ministry of Health and any other body that is supposed to look at it. They go through it, examine it, and like, okay, this is what has been done. This is what it will mean in terms of us giving this hospital back the money they've spent for this. So that's really the idea behind reimbursement. So it's not really about the patient. It's about the people who are giving you that care, because nothing is really ever free. Somebody has to pay for it, right? And in this case, it's the government trying to pay for it. So that's really the idea about reimbursements. And that leads me to two other things. Firstly, we had a really nice mechanism that was in place a few years back. We used to call it performance-based financing, right? Which was literally giving incentives to facilities that had, you know, that had quality care in various areas of healthcare. So it could be in terms of antenatal care, vaccination, pediatric care, and all that. So depending on how much quality care you offer, there are incentives that are given to the hospital to like, okay, you know what, you're really doing well. There's some little extra bonuses for you to keep going and things like that. But at some point, I think the PBF system had kind of failed because there was really issues with reimbursements. It could take months, sometimes even years for facilities to get reimbursed. And what happens when those reimbursements take time? Imagine you're running a hospital and you're doing dialysis for 15,000 instead of 500,000 that is supposed to cost you. So imagine you do that for 10 patients. You've literally incurred costs for about 5 million. And imagine it takes a year for you to get reimbursed. How do you maintain your dialysis machine? How do you pay your doctors? So at some point, hospitals or facilities kind of get tired of the waiting, and then they have to now start charging you for something that was free because they just need to recoup their costs. So it's really a very vicious cycle. Unfortunately, I don't have too much insight into the way the actual reimbursing mechanisms between the government and those facilities, but the whole idea is around agreeing with facilities that, okay, this is what we will subsidize for this particular service. This is what the standard service normally costs. So once we subsidize, you have to charge the patient this amount. And then at a particular frequency, we'll put together money and reimburse you for that subsidized and give you in to make up for that. And this now leads me to the next thing, like you said, financing. So what do we do to make sure that the money keeps coming in? Because if people are not getting reimbursed, it's because the money is not just coming in, and it's because it costs a lot of money to run a system like that, like UHC, right? So for the first phase, I think Gladys can correct me here. They're the ones who are doing the reporting. They have the figures. I think we spent almost what, 95 billion or so, and just about 50% of that is covered by the government. And we have other financial partners with the government that cover the other 50%. It just shows you how much still has to be done, right? So the government, yes, is chipping in something, but they're not chipping in enough yet, if you look at it from that percentage perspective. So they still have to chip some more, and it brings up question as to where do we get this money? How do we go about having this money, to finance this? And in as much as the theme of the year is health is in the government, the consensus around a lot of people who've done research on USC is the fact that at some point, no matter how much the government is chipping in, there needs to be some sort of public funding, be it in terms of contribution or in terms of taxes that have to come in to complement government funding. Otherwise, yes, the government is going to prevent people from having catastrophic expenditure or financial hardship, but then it's going to ruin the government. And we're going to find ourselves in a really difficult scenario. So maybe I'll pause there. Like I said, this can take a whole day, and I could always add some more if you want me to. Over.
Yeah, thank you so much. Like I said, it's really been an issue that's been back and forth for so long, because when we're talking about UHC, the big question is sustainability. Is it sustainable? Because this issue about reimbursement, I remember clearly, I've had interaction with a couple of people in the hospital, and most hospitals are not willing to engage because they are not sure that the funds are going to be coming back. And like you said, that's like running on a loss, and sometimes this plays out in the way they react to patients. It plays out on the attitude of patients. Sometimes patients that come with this UHC card, they're treated a little bit with bias because, I mean, the hospital is not sure when they're going to be reimbursed and all that. So the whole idea of sustainability comes in, because like you said, we have this beggars mentality. We are constantly being dependent on other people. But if you look at the dynamics of health, every country is responsible for their own health. And this goes back to, if you look at previous, how the national health insurance scheme of Ghana, that of Rwanda, most times they make it compulsory for the people to pay, because one way or the other, it's not just the government saying, you know what, we're trying to give you health at a very affordable cost, but it's also trying to make the citizens understand the importance of why such an agenda is put in the first place, and what the role of Cameroonians, because we're talking about Cameroon, the role of Cameroonians in UHC, because it's a two-way thing. It's not just the government, it's not always about what the government is giving. Yes, the scheme is there. Obviously, they are doing their possible best. Like I said, aside the fact that we have become very known for always begging for funds, always using things to exaggerate them to seek for external funding. The question is, what are Cameroonians themselves doing with regards to UHC? Because it's a two-way pathway. It's not just one person doing the job. So Gladys, I'm going to be coming back to you. I don't know if you still have the first question I threw that I said you should hold on to, because it's important. It's a two-way thing. For Cameroonians to be able to come to the realization that, okay, fine, whatever the conspiracy theories can be, or it's a political agenda, or the government is trying to scam us, or the government is playing on our mentality, but there is efforts being made. We cannot deny that. And with regards to advertisement, I can remember very well that I think I saw a popular Cameroonian comedian talking about UHC. If I don't know, I can't remember his name, but for me, that was like a good strategy, because getting these public figures that we are used to watching, because like you said, most Cameroonians will not watch news. People always believe that news is for the old and elderly people. I don't know why, but getting those popular celebrities and social media influencers to do advert on UHC was a good alternative for me. But now let me add my second question to the first question I gave you. Are Cameroonians really, really aware of the role they have to play in UHC? Are they even aware of what is needed to be done? What has been your experience on the field? When you talk about UHC, what has been the experience of the people? That's just like coupled to the first question. This is the other question that I wanted to just like play around it, because this issue of reimbursement, I don't know if you've had issues of people talk about whether it's a scam, it's a sham, it doesn't work, it works. So just like give us like a brief overview. Let's just be practical as much as we can.
Okay, answering the first question, our Minister of Public Health is one who is very active on social media, especially Twitter, and he tries as much as possible to give out messages in English and French. And if you go through his account, you'll see that towards the end of last year and the start of this year, he did publications that had to like give an overview of how the USC plan has been going. Added to that, the ministry has an annual report it publishes. I came across one in December, January, I think January. I came across one in January. I don't know how they make them available to people, but I came across a hard copy. I know that we have issues with ministerial websites in our country with accessing them, but you can always also check the ministry's website. I think they have tried. They've done press conferences to give out a balance sheet of how the whole process is going. And then the annual report I gave you, I don't know if there's an exact report on UHC, but you have the ministry's annual report that in need a section is dedicated to UHC that is like a baby to the ministry. Talking about the second, are Cameroonians aware of the role they have to play? Some are aware, some are not. Take, for instance, I live in the village. I'm Bayam Selam, the local woman in the community. And I hear people say, no, it's free, you should enroll, it's free, Breman, you will not spend a lot. And then I go to the hospital, and because these hospitals don't have enough funding, and so have to charge us because they cannot incur that a loss. And from what I've heard in the field, there is contradiction. You now see me going back home and saying Vermont saying so it's fake news, because they don't understand the background or what is happening in the background, and also the role they have to play. So I want to say it depends on our purchase capacity, because all of this has an influence. If before on a normal, I could really pay for good health care services, and then now they're telling me that there is some subsidy or it has been subsidized, I'll be happy. I will be happy because before I could afford. But someone who could not, and then they have reduced, and then you go to the field and you're not able to even benefit from this reduction, it becomes fake news. So that is what is happening in the field. And not all hospitals are complying to this. Private hospitals for sure will want to make benefits on how to pay their employees. So they will know if they don't have that assistance from the government when it comes to funding, there's no way people will go to that hospital or attest to the fact that they have experienced reduced costs. Plus, we Cameroonians, like now, I don't think there's been a lot of communication on our role. Like when you hear experts talk, just like Clarence highlighted, solidarity, the aspect of solidarity for issues that are predicted illnesses. So saying that they should come up with a scheme where we can contribute to help social, okay, like the hospital of the City District Hospital. There was one time we had to do a report on why they keep holding people back because they're unable to pay their hospital bills. Some of them, they keep them locked in the or they don't allow them to go back home because they've been unable to pay their hospital. Mostly pregnant women. Women will give have just been delivered of their babies or cases of emergency. Now they have a department that has to do with the social affairs social affairs department, and there they do investigations on if you're able to, if you're unable to pay your fee and everything and all of that. And it's in that department where you have solidarity coming, where, okay, if they have found out that you cannot pay, then they now do either the hospital, if the hospital can, they allow you go and they incur the cost, or people, they, from what the nurse explained to me, the lady I spoke to, the person in charge of the department, that they walk around trying to get contributions from people. So we have to also have that aspect of solidarity. It's not because the government has said that we will fold our arms and say that we don't have a role, we have to always just receive. In all of this, we have a role to play, and that's to assist the government. Private sectors, if you're in the private sector, you can also walk up to the government for a partnership on how you can provide funding for cases in the hospital. So it all goes down to how the government now can get us involved. Tell us, they have not really spoken to us. We just know that we have a percentage to spend. But if I have a percentage as someone who has money, it's fine. But someone who does not have even that percentage they expect us to spend, how can we help that person? That is where us, after the government has gathered all what it can gather from partners, World Bank, WHO, and all of that, we Cameroonians, what can we do? Now, other people, they'll tell you that, okay, I might provide some services for free to the hospital. Like the lady told me, the person, okay, you say after getting, if you've been treated, you now come and do some auxiliary jobs, maybe clean and help. That way, whatever they're supposed to pay you is what will go in now into the coffers of the hospital, because they have used it to cover your treatment. So those are different ways that we can be involved, but we don't know because there is limited communication on this. I know this because I've been on the forefront asking questions for understanding and I've gotten to know this. And just to add a question, when we're talking about, Clarence asked the question, where do we get this money and everything? In Cameroon is one of the African countries with a high consumption rate of tobacco. And for some years now, there's easy access to this. People are importing, we are buying. I don't know what the taxes, the customs department has to say on this, or what the law says when it comes to importing tobacco. But these are sectors, harmful things that we consume or we see that we have easy access in Cameroon, that if the government could increase taxes on this, that if you are an importer of this thing, you will pay this amount, and the money they incur from it goes into healthcare. I don't know. The coalition for the fight against tobacco consumption in Cameroon has been fighting for years. Left a letter at the presidency that they should place a law banning easy access and importation of tobacco in the country. But till today, they don't have any response. Just during World Tobacco Day, we were talking about how to intensify this call for government to take action, because it's a big risk to our citizens. And that is why we have people, TB everywhere. TB then leads to HIV and everything. So all of those risk factors, tobacco, to get funding, we place high taxes on them. If you must import, you pay those taxes, and then we use the money to fund healthcare. So I don't know if I've been able to answer your questions, but, and talking about the annual report, from what we had, what I saw, so 3 million people had been enrolled, because it's just the first phase. And since they have been enrolled, it means 3 million people, or a tenth of the population, have had access to subsidized healthcare funding, pregnant women inclusive. So those are some of the things that, and Clarence mentioned the budget too, about 95 billion that has already been spent. Yeah.
Okay, I have a very quick question for you. We're trying to keep to time. Now, I remember there was a time I was on a panel, and this same thing about 3 million people, 95 billion, and all that came up. And I was very inquisitive because, as somebody in public health, it's not enough, I'm sorry to say, but it's really not enough for you to, for the government to tell us 95 billion was spent or 3 million. In these 3 million people, can we have stratified data? You can't tell me we don't have enough statisticians in Cameroon. We have so many qualified statisticians, public health epidemiologists, and all that. We need a comprehensive report. Inside that 3 million, can we have it according to geolocation, urban, oral? Can we also have it according to gender? Can we have it according to age? Can we really, really have a comprehensive report? Because I think it's also our right as Cameroonians to know what's going on. For me, transparency is very important. And this is where a lot of mistrust comes from, because we hear figures, we hear billions, but we are not seeing it. And we are not, I always tell people, Cameroonians are not uneducated people. We are very learned. So there's no way you put out a report out there and we're not going to read it and we're not going to understand it. But to come out and tell me and say 3 million people were 11% of the population, to me, it's just, it's like the in French, they say that it's on a moles and lay. You're just talking in space. We need to read something concrete. We need to have those statistics. We need to have the facts. We need to have visuals. We need to have something we can hold the government accountable to. Well, as we're rounding up, I just have one last question before we top up everything. What do you think can be the role of young people in promoting UHC? Because as we all know, it's no more young people are the future of tomorrow. We're the future of today. We are the present. So, what do you think can be the role of young people in promoting UHC? Like I said, it's Agenda 2030. We're counting down just barely 5 years. Obviously, the fact that it's Agenda 2030 doesn't mean that by 2030 it must have been achieved, but it's just some kind of guidelines to keep us in track or on track. So, what do you think, as a young reporter on the field, based on your field observations, based on your personal encounters, what do you think is the role of young people, or what can young people do to push for UHC? In Cameroon, I'm talking about Cameroon. What do you think the young Cameroonians can do? If there is a young Cameroonian that will be listening to this or will play this record later, what do you think as a young Cameroonian? Probably I'm not in the health sector. Probably I'm not interested in UH. Probably I'm just hearing about UHC. What do you think young people can really do to push for the agenda of UHC? And regardless of whether there's compensation from the government or they're seeing you, they're not seeing you, in our own little corners, I always tell people the little effort put together makes an impact. So, what do you think young people can do to push for the motion of UHC in Cameroon? Because it's such an important agenda. I always tell people it's a fundamental right. Having access to health is a fundamental right. It shouldn't be a privilege for a few. It should be a fundamental right. It is a fundamental right. So what can young person do to promote UHC in Cameroon?
Well, as a young person advising another young person, I think it's time for us to take matters into our own hands and not feel like it's a particular generation that is concerned. So we need to engage more in advocacy. Me, via journalism, I need to be able to hold our government accountable, like you just mentioned. Give us these facts. Let's be able to communicate with the people that this is it. This is how much we spend. It's going to build trust. This is how much we lack. Maybe people want to join. So as a young person, it's time for us to join the journey and not say, no, they have to go ahead and make a way for us to come and join after when we've gotten to their age. It's time for us to act, to talk, to advocate. Even if it does not concern you, towards in your own domain, if you're a young teacher, why you can talk to students, just spread the word, advocacy, trying to bring change. And then for us in the medical field, young people, I know it's very challenging, but we can try to draw partnership and then go, because what is UHC? UHC is me getting healthcare whenever I need it, wherever I am, but not everybody can. So we have so many young people who are capable of doing things in our country, and they can pull people. So pull those people and go to communities where they need medical intervention. be a change maker in some of us are in communities that we don't have healthcare. Why not trying to pull people to come once in a while, carry out health campaigns that can help? I was really impressed by an activity a religious organization did that I covered. They went to some locality in Cameroon, in the central region, Doe. No road, nothing, no health centers. And there we saw children malnourished, HIV cases that they were not aware. But this religious group was able to pull, and all young people, mind you, they were young. They were able to pull in some medical doctors, some psychologists, because in that situation, to convince someone that you have your HIV positive or you're living with HIV, you need a psychologist, the nutritionist. So they're able to pull this class of people, and when they're under struggle, and brought in some change to the people in the community. So UHC, we all have contributions to make, whether it's advocacy or you, the change maker, by taking action, bringing in the change. Young people, we need to sit up and not feel like it's only the government, because we are, like you said, we are seeing young people coming into power. Very soon it's going to be Cameroon's time. So I, as a young person, I am pledging and I'm calling on others to also take that step to be a change maker, to change the narrative and not focus on the negatives or the lapses we have. Yes, there's no money, but I think there's something we can do on our part. You're a medical doctor. Try to also get partnerships that you can be able to get medicines from pharmacies, get equipment, I don't know from where. Telemedicine, we have young minds, create those applications that we can be able to use to help people access the health knowledge they need or the health intervention they need. Yeah.
Thank you so much, Gladys. So, one thing I want to leave with you, we will be asking for your final words, your call to action as we round off. But then I want to really appreciate, especially on the young people. I always tell people there's a lot you can do. There's a lot of giving back you can do. You're an epidemiologist, you're a public health, you're a medical doctor, in whatever field, health is holistic. There's always something you can do to give back. And it's always amazing when young people come together, put together a brilliant idea, and go all out for community. It's always something very beautiful that I love to watch and see. And I really hope that Cameroonians can embody it. It's not always about waiting for the government, like you said. It's not so about what can I gain from this thing. It's also about understanding what giving back to society means and what you as a young person you can do at your own end. Now, Dr. Clarence, I'll be coming back to you as we're rounding off so we don't take so much time. Now you're a medical doctor and you're also a researcher. I've seen your publications. So in summary, how can you what if you were asked UHC in Cameroon in summary, where are we and where are we headed? In those two questions, where are we presently? How much progress have we made according to you, according to your research, according to your practical experiences? Where is Cameroon in terms of UHC? How much progress has been made and where are we headed to?
Yeah, thanks for that really insightful question. And yeah, just to piggyback on the comments from Gladys around what we young people can do. There's always so much we can do, right? But we have to also keep at the back of our mind that when we talk of UHC, services should not be one-time thing, right? It's about when you need it, where you need it. So it should not be once in a while that people come to you to come and give you healthcare services, probably when you've reached the point where your disease is really deteriorated and all that. So I think the onus is on the government to really lead the way. And then as young people, we can always follow with advocacy and also supporting how we can. And leading the way will mean investing substantially in hospitals. In other words, the structures, equipping those structures, making sure that they're available everywhere so that people in all crooks and crannies of the country can actually have a hospital that they can access, and that hospital is equipped with personnel, with equipment that can actually, cater to their needs. It's also about investing heavily in patient treatment. In other words, you need to make funding available to provide those facilities with what they need to provide the healthcare to those people at reduced cost. So the onus is really on the government. And then as individuals, we also have to understand that the government cannot contribute the totality of money needed for UHC. There are various funding models that have been explored. We don't want to go into that. We're way above time already. We can be a subject for another conversation. But regardless of the funding mechanism we're using, one thing that's common is the fact that there has to be some public contribution. The public has to, in one way or the other, also contribute to the service. The government cannot do it on their own, or else the government is going to get ruined. A lot of countries have done it with way less allocation on health, 5%, 6%, 3.5, 4%. The countries like, Malaysia, Sri Lanka, that have gotten to a certain level of UHC with just about 3.5, 4.5, 5.4% of their GDP allocated to health. So it's really around thinking, and mixing funding models and seeing what really works best. So that's really a discussion for another day. In terms of where we are for investor coverage in Cameroon, I'd say it's a good first step. It's a solid first step. So there is a dedicated budget line now within the state budget for UHC, which means every year when the state budget is being voted and approved, there will be some money for UHC. That's already a big political leap, because it just guarantees the fact that there is thinking around UHC. Now, how that money is being used is a different story, but it's already a big political leap for us to have a dedicated funding line within our state budget for UHC. It just shows the vision in terms of wanting to pull this off, right? So that's why I said at the beginning that this is a good political agenda. It's one of those political agendas that are good. So that's already one. So for me, that's a really big step. For a country where things can be really bureaucratic, having that sort of step is really a very big plus. Yes, now we are really at the learning stages. So you asked me where we are really at the learning stages. I mean, like I said, nobody wants to invest billions of francs CFA into a model, into a scheme without really understanding how that scheme works or the most optimal way to go about it. Else you're wasting money. So we really are in the pilot phases, if I can put it that way, trying to understand what it is that works. And it's really from there that we'll be able to know, what comes next and how we go about it next. Yeah, so the truth is, I am happy that we are at this level. I think there's still a lot to be done, but it's already a really good, solid first step. I also just want to say that I think reports from the ministry are usually available. It's true that they may not be very accessible by everyone, but those reports are available, and I'm very sure before we want to go into phase 2 of UHC, we'll have a comprehensive breakdown of what has happened, because nobody's going to give funding to the government for a phase 2 if that sort of report is not available. So we'll have that report. So for me, it's I'd say overall, I'm happy that we are at the stage where politically we have a budget line for UHC. I'm happy that we have gone from thinking about UHC in 2017 to making it, happen. Now I am still expecting a lot more in terms of we need to invest more in our hospitals. We need to invest more in the quality of care offered in those hospitals, because UHC will really not be, the true social impact of it will not be felt if those facilities are not providing care to the quality that are needed by the population, right? So a lot to be done, but yeah, I'm quite positive. And yeah, let's see how phase 1 ends, how phase 2 unrolls, and let's see what lies ahead in the future.
Thank you so much, Dr. Clarence. I like the fact that we're positive. I think a lot of times Cameroonians are very pessimistic, especially with our health sector. In fact, with everything, we always lambast ourselves, we always insult ourselves. But the truth is, it's a good step. Like you said, we are still at the learning phase, and it's never too late to start. I, for one, I was very impressed when we started. It's never too late. We can't go comparing ourselves. Like there's a saying that the goal is to win the marathon, not to win the race. So I'm sure slowly but surely we're going to get there with much effort, with all the learning. And also collective effort has been done. So let's also try to put ourselves abreast. Getting information and getting knowledge is also our responsibility. So before I go to Gladys, Dr. Clarence, what are your parting words? What are your call to actions for as we continue the fight to achieve UHC, like we all said, it's a right. It's a human right to be able to access the basic of healthcare needs when you want, at a very I don't want to say minimal cost, but at a cost that will not put a strain on your financial budget as an individual. So what is your call to action as we depart from the webinar today? What is that call to action you're leaving us with?
Yeah, I mean, it's really about us as individuals, first of all, getting more interest into UHC, right? You cannot advocate for something you don't know. You cannot speak positively to something you don't know. You cannot assess progress made on something you don't know anything about. So it's really about us taking in more interest in things like this. Very often, a lot of things happen in this country that concerns us, concerns you, concerns me, but we really have reached a stage where we are really not moved, and we tend to miss out even on the very important things. So it's really about us getting to know more about UHC, getting to just dig deeper into it, so that we can better understand where we're moving as a country with respect to UHC. And I mean, the greater call is really on the government. Like I said, the onus is really on the government to lead the way, to structure things such that the funding is available for people to have access to services without straining, and also without the government ruining itself. So the onus is really on the government to pull forward. But my main call to action here is really for young Cameroonians to gain some more interest into things like this, into UHC particularly, just know more about the subject, and be open to the fact that for this to work at some point, we'll all need to chip in, be it by probably having a little bit more taxes cut from our pay, or be it by paying for social insurance schemes and whatever other duly available means that can be leveraged to finance this, right? Because somebody just has to pay for it. The idea here is just for the upper class or the richer people to kind of subsidize treatment for the poorer ones. So somebody just have to chip in and pay for this. Yeah.
Thank you so much, Dr. Claren. Indeed, we have to have a positive attitude towards UHC to move forward. So we're rounding off. We're just having a few seconds to go. So Gladys, what are your call to actions? What are your parting words as we close the webinar, both for those that are present and those that will be watching the record later?
Thank you so much, Ada, for this session. It has really been elaborative. And so my parting words is, I like the fact that we spoke about the progress and the challenges. So let's not just tell stories of challenges, but also engage in the stories of progress and possibilities. And also to know that all voices, all of us, our voices matter. So let's join the conversation, ask questions, and also embrace policies that prioritize our health in Cameroon, and to also ensure that UHC becomes a reality in every corner of the country. And one last thing, we are calling on the government to accelerate efforts for a legal framework that will bind all of this and make it a success.
Thank you so much. I couldn't have put it better. Those are like very good parting words. Indeed, UHC is a good agenda. It's a good thing. Health is wealth, like they say, and everyone deserves to have access to health. So, like the spotlight on this theme of Universal Health Coverage Day 2024 was on the government, and I believe the government has a very bigger role to play, whether it's bridging the gap, working in collaboration with NGOs, working in collaboration with community health workers, just opening up sector for funding to come in, trying their best to make this sector very elaborative. I think there's a lot of work that has to be done. And like some of the things you said, increasing taxes on certain contrabands and tilting those taxes or the incentives from those increments into the health sector. There's really a lot we can do. And like you said, our government has also been very active. I know for one that the Minister of Public Health has really tried. I've attended a couple of his Zoom sessions where he's literally on Zoom trying to explain what UHC is, trying to make people understand what UHC is. I've never seen it before for the Minister of Public Health to really come all out, trying to make people understand. As long as we want to judge, as much as we want to throw shade, it's an effort that should be commended. And he's doing his best, but one person cannot form a team. It's collective effort. So we all have our individual roles to play. So as my own take home message or my own call to action is, as we go home in our individual corners, let's try to reflect on the importance of UHC first and how at our own individual levels we can put our heads and our minds together, resources together to make UHC happen. So if you have any parting words, I want to give a shout out to you, Da Sule. I've seen you all the way from Tanzania. You're also doing so much when it comes to UHC. Thank you so much for joining us. If there is anybody that has a parting word to say, this is the time. If not, then we'll be calling it a session. Thank you so much, Yuda. So we'll call it a session, and thank you guys so much for joining. The recordings will be made available. So it's on that note, we say Happy UHC Day 2024, and we are looking forward to the day when Cameroon is no longer a beggar, but a giver of excellent health, and we all can be smiles and benefit from it all. So thank you so much, and have a wonderful evening. Good night to everyone.